Hello, our solution to combat substance abuse and overdose in youth is a program targeting multiple areas of focus presented to you today by Janessa. In coming up with this program, we started with our own unique observations as youth and having an understanding of immigrant parents. We also looked at perspectives from our siblings whom we have large age gaps with to compare how things have changed since we were their age. Additionally, we consider the ways youth can behave in the case of different types of parents where there may not be a strong understanding regarding youth and substance use. Our program can be broken down into three main categories. The first component is a center for parents, such as a dedicated meeting space or their child's school. There, they could learn the different types of parenting styles and which one they fall under. Authoritative style of parenting has shown lower levels of substance use in youth. Uninvolved parents are associated with substance use in youth, and this parenting style is considered a risk factor. Parents will also learn other risk factors, the signs of substance use in youth, and skillful ways to have tough conversations with youth. Having drug testing kits and naloxone accessible for youth in the home is important because knowing how to respond in the event of an overdose increases the chances of preventing fatality. Lastly, medications prescribed to someone else played a role in 31% of youth overdose deaths. This highlights the importance of patient education when prescribing and dispensing medications. Upon systematic review, 80% of studies reported sports participation associated with less illicit drug use. Extracurricular activities expose students to various settings and allow them to explore and find new interests. These also allow students to go to an alternative place if they don't have a great home life or are at risk of substance use. These activities provide a strong support network for youth with multiple people looking out for them. Being involved with substance use could result in serious consequences such as a loss of these privileges, further promoting the disadvantages of substance use. Adding alternative activity programs to schools would allow for youth that don't have the funding or resources to still be involved. Naloxone training is already being implemented in school districts around BC, and this has received positive feedback. This would be a good resource to add to our own program for middle and high school students. We would implement this as early as grade 6, since there have been records in BC of youth as young as 12 years old passing away from overdose, meaning we need to start intervening before then. We would implement a science-based educational video into the school curriculum about drug use and navigating social pressures. We would have a social media platform targeted at youth where this educational video and other resources can be found. Young adults that previously abused drugs are a relatable voice for youth. They would live stream for classes, talking about their experiences and answering questions. The core of our solution is to educate not only youth, but those that are close to youth. Our program is low cost, and by combining all these components on our social media page, it is easily accessible, easily shared, and there's the option to be anonymous. And that is our program. Thank you so much for listening, everybody.